unhealthy codependency is when you're so dependent on feeling better
Mhm.
only if that person that you're caretaking feels better. But
Mm.
then if they don't feel better, then you feel awful. You might even feel 10 times worse than that first
Mhm.
responder because you can't reach them and you get on this roller coaster right with them. How do we develop for our first responder families the ability to manage themselves and still have comfort and their own sense of safety while tending to the needs of their first responder? You know,
Mm.
it's like, and not being on that roller coaster with them and being able to be fully present and engaged
Mm.
in supporting them, but feeling stable within themselves if they can't be that person for them at that moment.
Welcome to the First Responder Families podcast, sponsored by Shatterproof at FHE Health, a nationally recognized behavioral health provider. I am your host, Ivona Bhadha, a director of family services at FHE Health and a family, couples, and trauma therapist. Join me for meaningful conversations and talks that support wellness and mental health of first responders and their families. Hello, listeners. Here is Ivana Bhadha with First Responder Families podcast. And I have a returning great guest, Dr. Sachi Ananda, a director of Shatterproof program at FHE Health.
Hi,
Welcome.
Anna. Thank you so much for having me, and hello to all the families of first responders out there.
Yeah, this is an amazing topic. We have been talking together for a few weeks, and we are not alone. This topic is about to rethink and redefining the term codependency because codependency is turning 40. And yeah,
Wow.
I think you and me, being in this field for a couple of decades, we have seen big changes also in neuroscience and developmental neuroscience and trauma treatment and understanding human behaviors. So we have seen a lot, and we continue educate ourselves. So, what is your understanding of codependency, like traditionally, how you were taught, how you were trained, and how you see it today?
Well, I just have to say, I just love this topic, and actually, you've really helped me, Ivana, even expand how to think about codependency and what's the healthy way to go
Yeah.
if you do suffer from and or someone you know suffers from codependency. Um, Back in what must have been 40 years ago, there was the Melody Beatty. She was the big founder of codependency. And
Hmm.
I really, in my work with addiction and in mental health, that's one of my favorite topics. But I am shifting how I'm looking at it as
Hmm.
we've both been talking about. And I guess what I always thought my first way of understanding codependency is having an addiction to worrying and caretaking somebody else's needs
Hmm.
in detriment to your own.
You're right. Hmm.
Um, and we were just talking, Ivana, about how us as therapists and as helpers, we may naturally put others before ourselves and our own needs, especially during a therapy session. We're there for our client, or we may go into the field because of how we want to help others.
Yeah. Something about helping, right?
Yeah.
Mm.
And I think that's how I relate to a first responder who is also driven and or bred and or instilled in values of helping people over yourselves. And
Hmm.
so that's putting codependency in the context of first responders is so interesting because is that a bad thing? Like that's who we are and what we do, and how do we know when it's become an addiction of
Mhm.
helping others, where it's actually damaging ourselves?
Right.
So I think this is really important for families of first responders out there listening to also consider what
Right.
codependency means to them, and does it make sense in their context and in their roles.
Mhm. I love what you just said. Can we understand codependency um, as something, not as a flaw, not as a something to get rid of or eliminate, rather, as survival strategy to certain circumstances. And some people have more tendency, perhaps, to adopt that strategy than others. And when it's becoming ineffective, rather to think about codependency, uh, trait, fixed trait or flaw that has to be fixed.
I think it's really valuable to understand codependency in that survival context and how it really, how we were raised and our relationship to like our major caregivers and family members in our lives growing up, like how much did that value, action, or behavior of taking care and considering others above yourself was just a way to survive every day in a traumatic family and or a dysfunctional family or just even just a stressed out family.
Yeah, yeah, exactly. The example would be just as a child going through a divorce, and losing the family system as a whole, and all of the sudden not having perhaps consistent attunement from one or both parents who are stressed out. So the child develops a certain belief system based on the event, and they may start thinking as a child, in terms of I have to disconnect from my needs in order to make sure that mom or dad are not, stressed out if I need them. And I need to figure out, how to be a good boy or good girl to maybe help them as they seem to be stressed out. Yeah. For a child, it's so hard to um, think like an adult. So they think as a child, they want to preserve that some sort of safety or security in their emotional relationships.
Well, that's such an important word, safety and security. It's I think of it like in a first responder context. Many first responders may grow up in households where they were um, trained and or defaulted to having um, be the rock or the person to help others to be responsible at a young age. So I think that's actually why they might even become first responders,
Mhm.
is because they've already know and are comfortable and feel safety and security in being that helper because that's where they were, that was their jam growing up. That's how
Yeah.
they got their self-esteem, their self-worth, their validation.
Mhm.
And so it almost naturally would make sense that they would become, as a profession, a helper and a rescuer. And how does that play into that comfort, security, safety?
Mhm.
And when does it then become excessive or too much to the point of it, like, like almost damaging
Mhm.
their other ways of healthy thinking or ways that they also have their own goals and other adult needs to feel safe, but trying to work against the instinct or the primal feeling of survival and
Yeah.
safety.
Yeah. Hmm. So their survival strategy may become their liability when it becomes accumulated stress of being there always for others and chronically neglecting their needs, perhaps not even being attuned to their needs.
Yeah. I do find in, the program here at Shatterproof, a lot of first responders here have a lot of PTSD, of course.
Mhm.
And not only do they feel disconnection or having to cut their emotions off to just work in their daily life as a first responder, but they also take that home. Like they also have to somewhat, or they feel like they may have to disconnect from their families and loved ones in
Mhm.
order to remain that rescuer role. So it's like not just on the job, it's like 24/7. It's like, okay, I just got off my shift after what, 48 hours, and I'm exhausted mentally, physically, but now I have my family, but I need to be there for them and look like I'm the rock. So again, just more further disconnection from their family and loved ones. Like, and ironically, they want to help more their families, but when they disconnect and disengage, they actually help them less.
Right. And if I am a spouse of exhausted first responder who comes home, I may just be like, did you get a milk? Did you get eggs? I need some relief. Kids, I have been with kids all day. Just an example. And they may not have capacity over time, to stay connected or even communicate that I need actually a reset. I need so the lack of communication may send a signal to spouse that is not a signal for safety or social engagement, and also the marital or family system may struggle with with this maybe this ineffective communication and reliance. Yeah, like a lack of reliance on each other in a way.
Mhm.
Mm.
Yeah, and I find that, we talk a lot about first responders being natural helpers. Well, they quite mirror their spouses and families who are probably also helpers.
Mhm.
And so when you are a spouse of your first responder and that first responder comes home so disconnected, disengaged, and you want so much to help them
Mhm.
that and you can't or you get pushback or rejection, then that could, deeply wound and just get more sadness, loneliness, detachment from each other because of that feeling of rejection and probably abandonment, emotional abandonment, and
Mhm.
things like that.
Yeah, yeah. Hmm. It makes me think about its, traditional definition of codependency was also like associated with some kind of like love addiction or loving too much, needing too much.
Mm.
And when I contemplate about it, it's really not from the lens of attachment and healthy dependency. There's not really too much of love, or the person doesn't love too much or needing too much. Um, there may be something about awareness, the self-awareness, of these needs, how much they need to give it to themselves, and how much the relationship can provide. And also certain self-compassion practice, right? Because if the partner is not available for the child inside of the person, it can be unbearable pain. Like you said, abandonment, loneliness, um, really rejection. But if this so-called codependent person is receiving support and help for themselves, they would be able to attend to themselves and and still hopefully being able to communicate and repair and recover that disconnection.
Mm.
But I think the dependency becomes ineffective if that adult doesn't have a self agency on board. Everyone has self agency, but if that old pain from like childhood, maybe neglect or the injury that happened during the childhood, if that comes online, I am afraid that that's what was called codependency, but it is more about that, the person's adult agency has to come online, and they have to have some sort of self-compassion, which I teach the spouses and family members in our different virtual family groups, to
Mm.
balance it out because it is painful caring
Mm.
for someone whose mental health is not stabilized. They grieve the person that person was before their mental health, uh,
Mhm.
yeah, before their mental health issues.
Well, I was that really there's so many points there that you're bringing up, and what stands out is that the needs that you have, that you needs that you had growing up, and let's say the spouse of a first responder in their family history, they were raised and taught not to um, identify or focus on their own needs, that they had to give that up in order to survive or for the family to function.
Mhm.
And then as an adult, bring that in. And when that you don't know your own needs because you're so focused on the other person, um, you may be really susceptible. And this is what I think of unhealthy codependency is when you're so dependent on feeling better
Mhm.
only if that person that you're caretaking feels better.
Yeah, that's the key.
But
Hmm.
then if they don't feel better, then you feel awful. You might even feel 10 times worse than that first responder because you can't reach them and you get on this roller coaster right with them. And
Hmm.
that's what I'm thinking when you, Ivana, bringing up that self-agency. It's like, how do we develop for our first responder families the ability to manage themselves and still have comfort and their own sense of safety while tending to the needs of their first responder. It's like, and not being on that roller coaster with them and being able to be fully present and engaged in supporting them, but feeling stable within themselves if they can't be that person for them at that moment.
Yeah, sounds true to me. Yeah. And actually, the road of recovery is not what we had been hearing for those 40 years in a way, or at least for 30 years that, you have to stop enabling, you have to stop being codependent, what's wrong with you, that you are making the same mistakes. And I think the road of recovery is not as much to um, stop something, but I would say start to looking inside more. Um, and we don't have to necessarily know why, like why and stay there in the past, but we need to acknowledge that those formative years and childhood circumstances did affect us. Most therapists I know, for example, than less, most of them had something happen to them in their childhood that led them to become that golden child in the family. And they got praise and they got, maybe even loving presence of adults if they were helpful, if they didn't have any needs, if they didn't have any problems, and if they were actually very helpful and they identify with that as if I am the little helper, I will get love. And I think that's the loss of being authentic self. It's at the cost of losing the authentic self.
Yeah. Wow, and I think there are likely probably plenty of healthy adults who maybe grew up in those more dysfunctional, traumatized environment, and they may have learned to tend to their needs, but their body may still be responding in a fight, flight, or freeze mode,
Hmm.
um, because we know what trauma just stays in the body. So
Yeah.
I think if moving towards, like you said, not taking away or stopping, but adding that self authenticity and or self focus and awareness, where if your body reacts to your first responder who is struggling, to not react and think that it's a reflection of yourself, to be able to uh, stand strong within yourself, knowing that it's just a bodily reaction,
Yes, yes.
right?
I um I often share, especially with spouses that we have in our support groups, that when I was setting boundaries with someone like those really verbal, I'm not going to speak to you about something. It's not okay to discuss this topic. I was literally shaking because it was exactly that a reaction. And then there was that adult agency saying, this is sounds true to me. This is very important to say to another adult family member. And I was shaking because I knew she's gonna have negative reaction. So we already know that our boundaries, for some people, they will be disappointed or they will be upset when we set boundaries. And so I knew with adult agency what I'm going into, but that bodily reaction, it was like as if I was just walking on, I don't know, hot coals, like,
Yes.
and
Yeah.
I was going against my somatic learning that in order to keep peace, you don't say what you prefer, what you don't prefer. But I'm sharing this just as a what happened afterwards. It was amazing win. And since then I have done it several times. And I realized, unlike the child inside of me was scared that, okay, this is the end of this friendship. This is the end of the relationship. That's what I was really afraid, that I will push that person away. And on the contrary, the opposite happened, like I eventually, not right away, I got the pushback, but then the respect, came along, so I just think that you are really right that we are just have to often do the very brave thing.
Yeah, yeah, that's true.
Yeah.
And what I think just when you think of codependency as being, a disorder or just being another form of addiction, I think it's important not to think of the cure to codependency as the extreme opposite, which is like individualism. So I
Mhm.
really think, for our first responder family, that just doesn't make sense. Me being an Asian American,
Mhm.
where it's a very collectivist culture, very much a natural value to put others before yourself. It's like I always thought, wow, I'm never going to get better from codependency. I will never move, and nor do I even really want to just be this individualistic extreme where it's only about me and how I feel and not considering the other person. So I think putting that like I love that term, that interdependency or
Mhm.
um, self-agency, just things like that, I really feel like for myself sits better with my culture and my values and my job as a therapist
Mhm.
too.
Mhm. Right. Yeah. So you are bringing that really a sweet spot that it's not really on being on the other side of that codependency pattern that would be some sort of ultra independence. It's actually we want to move somewhere in the middle sweet spot where we can rely on ourselves and we also do take into consideration our deepest longing, which is the longing to belong. You know, we don't, if we cannot ask anyone, if it's just one person in difficult moment, difficult times, crisis, if we cannot turn to someone, we actually feel like we don't belong on the very deep, deep level.
Wow. Yeah,
Yeah.
I can see how that hits that primal need of belonging and
Yeah.
yeah, I love that, especially for all the everybody listening out there is that importance of being able to offer the help, but being okay to accept the help.
Yeah.
Having that two-way street, to me that sounds much more balanced and feels better even just in my body saying that it's and that's a message we really preach at Shatterproof as far as, it's okay to ask for help. And in fact,
Mhm.
um, I think as a survival need, we need to ask for help.
Yeah.
Even if our body is screaming, no, don't, it's not okay. It's, and
Mhm.
rejection, abandonment if I ask for help. But I love the story you were sharing about that because it sounded like that was a somatic reaction when you were setting boundaries. Is like this person's going to leave me, won't like me, I won't have a connection anymore. I think that's very common, and the more we tune into our bodies and just that awareness, and just keep going forward with what we know is healthy.
Mhm.
And ultimately, it actually really improves a relationship. That's what's so crazy about it is
Mhm.
you think it'll ruin it, but it actually strengthens it.
Yeah. Yes, yes. And unconsciously there's a fear of that if I will be authentically me, I will lose that relationship. That's in translation. Of course, it's not so conscious. But when people work on self-awareness, whether are the spouses, family members of first responders, or first responders take that step to take such a really holistic mind, body, and heart treatment that we provide at Shatterproof, with the self-awareness, they can really tap into the adult agency. Yeah. And really that's where authenticity is. And yeah, the right perspective also is there when people get their mental health into optimal state. We just get perspective.
Mhm.
And we continue learning.
Yes, absolutely. Mhm.
So as we are landing here, is anything else you would like to say? Maybe to our listeners, what would be those top things to focus on to become effectively dependent person?
Well, I just want to give a lot of credit, like if there's viewers and listeners, even listening right now, that's a brave thing and a very responsible thing, and that's the self-agency part is you taking part, just learning more about yourself and your loved one, and um, being more self-aware and just sitting through a podcast like this in itself is brave, and it may be your body right now might be really reacting, or some things might have really hit home and you can feel it in your gut, and it just makes you really more in tune with yourself, knowing that this might be hitting a chord. And I just think that's a huge start, and give yourself a lot of credit for for even getting this far.
Yeah, so much hope you just shared with the listeners. Yeah, there's hope. There is different way, how to relate to others and to self. And I want to read something for you. It's very brief, but it resonates with all family members of our patients I work with. And it says, "You can't pour from an empty cup, but when your cup is full, you pour wisely."
Oh,
And
wow.
that really speaks speaks a lot about just balancing, knowing yourself, understanding yourself, and that way you will respond to another adults wisely, and when it comes to children, there is a natural codependence with children, but when we are taking care of ourselves and when we have our cup full, then we are a resource to our children. We are a good, safe haven for them. So, yeah, I'm just so excited about our conversation and our continuous exploration of this topic.
Awesome. I love that quote.
Mm. Take care, everyone. We'll see you next month. And thank you, Dr. Sachi, for being here and share your insight with us. Bye.
Thanks for having me. Take care, everyone.
Thank you for tuning in. The First Responder Families podcast is sponsored by Shatterproof at FHE Health, a specialized treatment program for first responders with mental health and/or substance use issues. For more information about our show and our services, check out fhehealth.com. The podcast website also has a place where you can share your ideas or questions for future shows. If you are struggling, we want to help. Feel free to call us at 844-714-3403 or visit fhehealth.com. We look forward to having you join us for our podcast next month. Until then, take care.